So the goal for today is for our panel of experts to share some of their knowledge, and hopefully each of you will go away with one or two pearls of wisdom that perhaps you didn't have when you came in, and it'll also stimulate conversation and discussion amongst yourselves and your companies in order to better understand this daunting topic. So the panel is going to go in the following order. Dave McDermott and Stuart Kerr from the Lake County Health Department and Community Health Center will go first, followed by Russ Wareeye from RWI, a local insurance broker, Larry Stanley from Vista Health Systems, and then finally Sean Dorgan from Land of Lincoln Health. After the panel has each had a chance to give a couple of minutes of their introduction, then we'll go to questions. We have a few questions prepared, and certainly we'll entertain those from the audience as well. So with that, Dave McDermott, you kick us off.
All right, good morning. Daunting, I think, is a good word, and one thing I encourage as I go around and talk to different groups about the Affordable Care Act is to get as much input as you can. So the Lake County Health Department received a grant from the Illinois Department of Public Health to train and certify navigators who can assist with enrollments in different Affordable Care Act programs. We have about 60 to 65 that are certified right now and able to help. We envision another 20 to 25 will be added on to that. These are individual counselors who can help you navigate the website, help you set up an account, help you do everything except select a plan. So that's where their input stops. Their input can take you up to the point of viewing the different plans, and then you can either make a choice on your own, you can contact a broker to get help with a plan. But on a whole, big scale, our vision is that we're receiving these funds from the state to help enroll individuals across the county. So we know there's about 70,000 uninsured individuals in Lake County, and our goal is to enroll 20,000 of those in some new form of insurance by June 30th. So for some people that's Medicaid, for other people that's purchasing insurance through the marketplace. So, and the last thing I'll say as introduction is that we try to take a very collaborative approach in our implementation. So we have partnered with about 25 different agencies throughout the county to enroll or to have navigators, have individuals who can assist on their staff. So I'll keep it very brief, but that's who I'm here to represent.
Thank you, David. Stuart?
Thanks. I represent the navigators Dave spoke of. In my involvement with the Alliance for Human Services in Lake County, that was one of the groups that received the grant money passed through by the health department. And we trained a number of navigators, and we've set up shop in North Chicago on the east side of the county and in Round Lake on the west side of the county, prepared to offer advice to people and help them navigate the process. So going forward, my job has been outreach primarily as we wait for things to gel, but going forward we anticipate a tremendous increase in the enrollment process. Thanks.
All right, very good. Russ?
Good morning. My name is Russell Wareeye. I run an employee benefits consulting and brokerage firm. I think it's funny, but most folks don't know that logging onto the government website to try to get your health care is frustrating, right? But you can work with your broker and get just as frustrated. So we actually, advisors and brokers can work on the exchange to help folks get coverage as well. All you have to do is be licensed to be on the marketplace. My firm is, we're contracted with all the top-rated national companies, Blue Cross, Aetna, Humana, United Healthcare, et cetera, but also we're contracted on the marketplace to help you folks navigate that as well. There's some big changes that have come about for January 1st for small employers. You have to comply with the new regulations, but what's nice is there's no longer any medical underwriting. You might already know that. The rating is now going to be structured based on your age, so you're just going to enroll right into the plans knowing what it's going to cost without having to go through that underwriting process. I think it's important for 50-plus employers in the marketplace today to make sure you're compliant with ERISA, because the government's hired 800 new auditors, and they're looking for money to help fund this health care program for the small employers, and they are out auditing large plans to make sure you have a federal wrap document, that you're providing the appropriate federal notices, et cetera. So make sure you're working with an advisor who can help you through these things. And with that, I'll turn it back over to Hal.
Thank you, Russell. So we've heard from an insurance broker. We've heard from the county. So now how about one of the hospital systems? Larry Stanley.
Thank you, Hal. Larry Stanley, Vista Health. hopefully you all recognize we are the hospital in town. We have 2 hospitals in town, plus a number of primary care locations located throughout northern Illinois, radiology centers, urgent care centers, EDs, surgery centers, and we are here to help provide that care that everybody's trying to sign up for. We are also involved with the Lake County Health Department and others in trying to explain the new healthcare policy that's out there. There's a lot of information out there, some of it's misinformation. We've been also putting on presentations to the community to provide information about how to sign up. Without going too much into it, because there is a lot of information, there are 66 plans competing for your business as an individual out there, from Humana, Blue Cross Blue Shield, your company, Land of Lincoln, and Aetna. So there are plenty of choices and plenty of opportunities to get good value in these exchanges that are out there. And I'll stop there for now.
All right, very good, Larry. So you tossed the ball over to Sean already. We have Sean Dorgan, Land of Lincoln Health, who's going to be one of the providers of insurance under the new program. So, Sean.
Good morning. Thank you very much for having us. I'm Sean Dorgan. I'm the Director of Channels at Land of Lincoln Health. We are the first and only nonprofit health insurance co-op in the state of Illinois. So as a nonprofit, we don't have any shareholders, very different story to tell, and we're a co-op, so we're very focused on our consumers. It's one of our sole missions. So our mission really is to make sure that everyone in the state of Illinois has access to affordable, high-quality health insurance. So we work with guys like Russ to make sure that everyone here has insurance, and also guys like Lake County Health Department and hospitals where possible. So I'll kind of let it go there and take some questions from.
All right, so for our first question, Larry, we'll start with you. You mentioned that there are 66 plans already available here in Lake County. Would you look at that as the best part of the Affordable Health Care Plan, or is there some other component that you feel is the most compelling?
I think there's 2 components to that, and the big 2 things that aren't going well, obviously, is the exchange computer system, and I think they'll get that fixed. The other issue that's out there right now is that people are getting cancellations. And if you don't know why that is, in the plan, there's essential health benefits that are in this plan. For example, I'll just read them off quickly. For anybody who has pre-existing condition, you can still get insurance. Ambulatory patient services are covered. Hospitalization, emergency services, maternity and newborn, and I'll come back to that. Mental health and substance abuse disorder, prescription drugs, lab services, preventive and wellness services. There's a lot of things that are covered there. Chronic disease management, pediatric services, including dental and vision care. A lot of the folks out there that are getting the letters saying that your plans are being canceled or need to be adjusted don't have all of these things included in the plan. And that's why those letters are going out there. And there's pros and cons to that. If you're like you and I, Al, we probably don't need maternity services anymore. At least I don't think I do. And there are people that are getting, that's not right to them. I guess the only analogy to that is if you live in a community and you pay taxes for the school districts, even if your kids are grown up and gone, you still have to pay those taxes unless you want to move. So that is why that is happening out here, if people didn't understand that.
All right, thanks, Larry. Let's take our next question to our guest from Lake County, David Stewart. With all these choices out there, and with the fact that even though we were assured that none of our current plans would be canceled, I like to use the term eliminated, it's a little softer. How does someone go about sorting out what the best choice is for them? Is the best program to look at a provider, a broker such as Russell, or is there some other methodology for really drilling down to what is the best plan for me?
Well, one of the challenges of this law is that it is very unique to each individual person. And what we found is that people care strongly about their providers, so they want to make sure that their provider's in network. So as you're looking at a plan, you should be thinking, if you have a provider that you like, you want to make sure that they're covered by the network of the plan you're selecting. Another one that's a big issue for people is prescription drugs. If you know you're going to have high prescription drug costs, you want to pick a plan that has good prescription drug coverage, that has good formularies. So there's different issues with everyone. What's nice about the navigation program or about using a broker is that they can help you navigate, or they can help you understand a lot of that and help you answer those questions. Because looking at 66 plans is pretty intimidating if you're not that familiar with health insurance plans and how they function and how they work. And so those resources are there for that reason.
Cost is certainly a component of this. So maybe you can address this, Stuart. How do you know whether or not you qualify for subsidies or if you're going to be on full pay with the plan?
Well, the navigator takes the personal information from the consumer, and then the system will identify whether or not they're eligible for Medicaid or whether they're eligible to shop in the marketplace. And for a lot of people, it is driven by cost, but as Dave mentioned, for a lot of people, it's driven by other factors like certain doctor needs or certain medical needs the individual might have. So our navigator's role is to help these people identify what their primary needs are and then steer them in the direction of those plans that they should be considering, and then they make the choice, of course, of the final plan.
All right, now, Russell, maybe you can address a little more on the issue of cost, because we probably all talk to people who have either tried the system or we hear the anecdotal evidence, which can always be dangerous. But I hear things from, wow, I went on and it was very, very affordable. I couldn't believe what a great deal it was, to the email I got last night about the situation that Larry used a unmarried person who suddenly is being mandated to take the maternity insurance. So how do you go about, where do you see price migrating to over the next 6 months, a year, maybe 2 years down the road?
I wish I knew that. I don't. But I will tell you that the reason to go on the exchange and look for coverage is to obtain a subsidy. Otherwise, if you don't qualify based on your income for a subsidy, and that's less than 400% of the federal poverty level, which is 43,000, I think. 45. Then you probably don't want to go on the exchange and try to figure this out yourself. You probably want to work with an advisor, and I'm not just promoting myself, I'm saying work with your own individual advisor, or look outside the marketplace for coverage, because there are many other choices. In the federal marketplace, which is, they're working with the state to develop this website, you really have only 66 plans and 4 carriers. You don't have access to the other carriers. And the same plans that are on the marketplace exchange are available off the exchange as well. So the only advantage really truly of going through the exchange is to obtain a subsidy. And the small group exchange isn't open yet. So that for the employers, this is just speaking to the individual marketplace.
Well, let's talk about the employer side for a minute. Sean, maybe we'll go with you, because we do have a lot of business owners or people in the room today who might be responsible for the implementation of the plan. What are some of the concerns that you have from an employer standpoint that you can address with as a provider, such as compliance and making sure you have the right offerings for your staff?
There's a lot of concerns there, and I'm sure Russ would love to talk even more to this. We brought up ERISA, but there's a lot of standards and conformance coming through healthcare reform and the ACA, and employers are going to have to be responsible for that. One of the big things, actually, I was asked about it this morning, but if you're larger than a 51 plus employer, there was a penalty. That penalty's been repealed, so you do not have to offer health insurance to your employees if you're a business owner. So small businesses and large businesses alike can not offer health insurance and not get a penalty for that. As far as getting in compliance, there's a lot of rules, a lot of regulations that advisors can help you with. So I would definitely advise seeking out your broker and talking to them about how you can get compliance with the ACA. More importantly, all the healthcare plans that you're going to see on the exchange and off the exchange have to be in compliance with a qualified health plan, which means they have to provide the essential health benefits and many of the benefits that are now standardized that may not have been standardized prior to the ACA.
All right, very good. We've heard a round of questions from the chamber and from myself. Are there any questions from anybody at the floor at this time? Yes, please, go ahead. Please identify your name and your company, please.
Randy Murray, Paramount 7. The Affordable Care Act, to my understanding, was for those folks that don't have insurance. However, I'm seeing an effect among family and friends who have covered plans through their companies that are being tripled. And it's being passed off as a function of the Affordable Care Act. Can someone address that issue? This is real. My daughter had her insurance company plan through her employer. So can somebody address this, control on this, or if the insurance companies are using this as windfall? Does anybody have any ideas or thoughts on that?
All right, great question.
I can
Ross,
mention
you want to go first?
a couple things that are happening are that the health insurer tax, the reinsurance tax, and the PCORI fee, which are all applied to, if you're speaking to small group, that's what's happening. It's happening to large group too. It's actually line itemed on your bill now as an employer. You'll see what taxes you're paying. And they're being passed on from the health insurance company to the employers. They're being built into the individual premiums as well. That's the reason, that along with having to add in all these essential health benefits that are part of the plans are why your rates are going up for most people. The real benefit from healthcare reform and the Obamacare program is that folks that couldn't get insurance before can now. And folks who didn't make enough money to pay for insurance can buy it with the subsidy. That's what we're seeing. Really, it was a push to get the folks that didn't have insurance to get insurance. But we're all paying for it in the end in increased premium. So that's the reality today.
Could I add one thing?
Sure, absolutely. Please do.
So one other thing I would add to that is that they set ideal limits for what you should be able to pay, or the max that you should pay for your health insurance. So for an individual, that's 9.5%. You shouldn't pay more than 9.5% for your health insurance. If you get into families and dependents, it can get a little different than that. But for an individual, it's 9.5%. So in other words, if your daughter is paying more than 9.5% of her income for insurance, she can opt out of that employer coverage, go to the marketplace, and receive a subsidy for lower care, or for a lower price.
I have
Yes.
a question. I'm a provider, I'm a mental health specialist. How is this going to affect, I take insurance. How do I either get on so that I can take some of the clients who are on Obamacare? Or, I mean, it has to affect providers where a lot of people are gonna drop their Blue Cross Blue Shield, which I accept, to go to Obamacare, which I'm not on. How does that help? I mean, and I'm an LCPC, so I can't take Medicaid in
All
this
right, just
state.
from my perspective quickly, or Vista's perspective, Vista participates in all 66 of these plans. We're in all of them, and our physicians are. So it is getting with the insurance companies and making sure that you're a provider for that insurance company, and Vista is for all of these. And I believe our competition in the county is not on all these plans, so that is an important thing to consider.
Well, and the good news for you is that mental health and behavioral health is an essential benefit. So all the plans will address that in some way.
Uh-huh.
All right, Sean, maybe you could dovetail from that. So what are some of the things that may not have been covered in previous plans that are being offered? I mentioned earlier the maternity leave is now sort of universal coverage, and mental health, David just mentioned. What other benefits that many of us may have been left behind on before are now available through the Affordable Care Act?
Yeah, Larry went through a pretty good list of the essential health benefits that are out there, so, and they're right here, actually, I can reread them for you if you'd like, but, so there's a ton. Mental health is one of them. I'll look through
There's,
a little bit.
in addition to what I mentioned earlier, there's a bunch of preventive screenings, alcohol misuse screening, counseling, screening for blood pressure, cholesterol, colorectal cancer, depression, type 2 diabetes, HIV, syphilis, tobacco screening, cessation, immunizations and vaccines, obesity screening and counseling, sexually transmitted infection prevention counseling, and aspirin use.
So
there is a broad list of things that are covered. It is a very robust plan. You're getting a Cadillac plan almost. And again, that's positive and that's negative in certain cases.
So and those are broad baseline benefits that all qualified health plans have to offer. So one thing that we haven't really talked about, and I mentioned a little bit, but not all silver plans or gold plans or bronze plans are both alike. So we really encourage people to get out there and shop and to look at the plans that are available. So you might see a bronze plan that has a $5,000 front-loaded deductible, which means you're not going to have a PCP copay or a specialist copay or an RX copay, and you're not going to get any benefits until you hit that $5,000 deductible. There are plans out in the marketplace just like that right now. There's also richer benefits where you have a $500 deductible on the front end. You have PCP copays and RX copays. So we really encourage people to get out and shop and look for your monthly premium that makes sense, but also the benefits that you're going to have in that plan that make sense for your total cost. It's not just your monthly premium. It's not just about being the cheapest rate. You have to make sure that it fits you and your family's and your business's plans.
So it almost sounds as if, based upon that it's not just about the big upside benefit or for those of us with pre-existing conditions, we're not going to be locked out. But on the other hand, if you do have a pretty good handle on what your medical history is and your own personal state of health is, you can more practically shop around to find something would be a better deal for you.
Definitely. There's going to be more options, right? So instead of just the 3 options that your employers offered, you're able to go out and see 66 different options, which is confusing and very different. And if you go off the marketplace, there's even more. But it gives the consumer the ability to shop for a plan that makes sense for them and their family.
All right, very good. Yes, sir.
I believe Russell mentioned that the qualifier for tax and exemption is 400% of the poverty level. That individual poverty level is about $11,000, but it could be higher for a family of 3 or 4. So that income level could be $80,000, $90,000 in some cases. Is that correct?
It's exactly 94,200.
Yes.
And as you go down, there's a sliding scale of the benefit or the subsidy. The less you make below that, family of 4,
Yes.
400% is 94,200. You go down that, you're being compensated, and the less you make, obviously, the more the subsidy would be.
All right, any other questions from the audience? Yes, please.
Ron Grant, First Midwest, and kind of along the line of consumers report with cars. Are there any independent rating agencies yet that have come out to sort of, 66 plans is a lot of plans. So any that's come out to sort of categorize best choice plans and rated those plans yet?
It's a good question. Most of the big carriers that have around, most businesses have been around for a long time, go through BBB or financial rating with several different financially rated companies. So you can AM Best is another one you can look at, but there's a lot of different ways to look at that, I guess. I'd say the more important thing is to make sure that you understand that qualified health plan forces you to have essential health benefits and all these other baseline benefits in place. So it's a pretty rigorous process to be offering health insurance on the federal marketplace. Believe it or not, the government has a lot of rules and regulations for being able to offer those plans. So keep in mind that if it's on healthcare.gov, it is going to be a very strong company that's financially backed and able to pay claims.
All right, thanks, Sean. Next question. All right, let me ask another one related to, we talked about tax credits for individuals. What kind of tax credits are available for companies, if any, that as they seek to get enrolled in the program? You're shaking your head, David, go ahead.
Sure. So, well, the first thing, if I was a small business, the first thing you want to determine is your FTE. So determine how many FTEs you have, and you'll basically fall into a couple different categories. If you have less than 50 FTEs, you do not have to provide insurance. It's an option. If you have more than 50, it's delayed a year. It wasn't repealed, but it was delayed a year, so you don't have to provide it right now, but in 2015 you will need to. The tax credits for small businesses come in if you have less than 25 FTEs. So if you have a small business with less than 25 FTEs, you would potentially on the shop marketplace be eligible for some subsidies to help you pay your portion of the premium cost for individuals. It depends on it depends on some of the income that you're paying. If you have 5 employees but they all make $300,000 a year, you're not going to qualify for subsidies. But if there's some
The
income
average
things
is less than 50,000 for all 25 employees. If you average it out and it's less than 50, then there's a tax credit available for small employers with 25 or fewer employees.
Then as the business owner, I think you have to determine whether that's worthwhile to you or whether you're really better off recommending that your employees go individually into the marketplace. They could be better off that way.
And another thing that'll be nice, I think, for small businesses coming up, not this first year but in year 2, is that historically it's been hard for small businesses to offer choices to their employees related to health plans. So it's usually you have one plan, and if you want to do it, you do it. If you don't, you don't. But starting in 2015, the small business employer will be able to go onto the shop marketplace, select a couple of plans that their employees can choose from. So you may have employees that want different things related to their coverage. And that's a new thing that's part of the marketplace that I think will be appealing to small business owners, because they'll be able to insure both a 27-year-old employee who probably has very, very different health needs than say a 52-year-old employee with dependents. They'll have different choices that they can offer.
All right, then one last question, which is, for an individual, what are the penalties for an individual if that individual chooses not to enroll? You're shaking your head. Go ahead, Sean.
There's plenty of them, I guess. And you guys can back me up on this. But the first year, so basically you have to have health insurance for 2014. If you don't, then in 2015 on your taxes, you'll have a $95 tax per person, max of $295 to the household, which is going to ratchet up year over year. Message being, consumers are responsible for their health insurance. So you need to get it. If you don't have it, the government wants you to have it, so they are going to penalize you for it. The bigger focus, though, I think, is to make sure you understand that this is a benefit, right? This is a new thing. It's a good thing. So getting health insurance is important for all of us. In order for the system to work, everybody really needs to be insured, especially some of the young and healthy people, so that the system actually works. But rather than focusing on the penalty and the derogatory piece of you need to get health insurance, I think about the benefits of having qualified health plans that have essential health benefits and bring all these plans up to a higher standard and make sure that you have access to the care that you need, and also the communities that you live in have access to the care that they need.
Alrighty, so in order to get us all back to work on time at 9 o'clock as promised, we got about 90 seconds for each of you to give us one last closing thought and close any gaps that we may have missed so far. So Russell, we'll start with you, and then we'll come right down the panel and end up with David.
This is the first time I've been in a room talking about insurance where everybody wasn't half asleep, so I gotta say, thanks for listening to us and enjoy the rest of your day.
All right, thank you. Sean?
Appreciate it too. Thank you very much for your time. We're the first and only nonprofit health insurance co-op in the state of Illinois, focused on individuals and small businesses, nonprofit, no shareholders, and we're working really hard to win your business.
Vista Health has individuals that can help you work through this also, along with the Lake County Health Department and Navigators. And to set up an appointment to talk to somebody to walk through the exchange, 847-360-6955.
All right, very good. Sean, or excuse me, Stuart?
Larry did better than what I could do. The navigators are waiting to take your calls, as they say. And that's what we're doing right now is outreach. Everybody we're seeing is just helping them understand how these aspects of the law apply to their individual situation. So I would recommend anybody find a navigator, talk to them about it, and that way you can talk about your own personal situation and get a good feel for it before you make a decision.
Very good. David, you get the final word.
No, thank you very much for letting us come and sit up here today. I guess my final word too would be that I think each of us have agreed to stay around a little bit afterwards if people have individual questions and want to ask us individual questions here. We can do that for a couple minutes. Otherwise, just thank you for letting us come up here and sit.
Well, and we want to thank our panel of experts this morning, David McDermott and Stuart Kerr from Lake County Health Department and the Community Health Center, Russell Warai from RWI Insurance, Larry Stanley from Vista Health Systems, and Sean Bergen from Land of Lincoln Health. Our goal